Greetings, welcome to our presentation. As you can see on the screen, we're gonna talk about growth plate fracture. First thing first, here's a member list small group discussion of B3. And also, I would like to introduce myself. My name is Gayatri Karuniaputri, which will last ticket name 235. Let me start by saying a few words about this topic's background. We all know that bones is one of our best skeleton supports that owns by a living creature, including human. So we can deny, in fact, that children have a greater number of bones. These bones someday will longer, unite, and stronger. There's a specific bone called as growth plate. As it implies its name, it has a function to grow. This critical part of bone also has the potential for problem as well. When it comes to having a trauma or injury or might be a fracture, it can lead to complications for the child, decreasing its function and its growth, resulting in a shorter bone, which impacting the head for the child, or can affect their daily activities. Considering its important role, our small group discussion will talk about these topics furthermore, especially growth plate fracture. That's all from me. Thank you.
Hello everyone, my name is Fricillia Wijaya with the last strategy name 836 and I will explain 1.2 problem formulations. So there are 8 of problem formulations that will be the main problem and will be discussed in our student project. The next one is 1.3 is objective of study. In the total, there are also 8 of objective of study. They will be answered the previous problem formulations. And the next one is 1.4 benefits of study. The benefit of writing this literature review is to give information about growth plate fractures. Hopefully, submitting this literature review can be helpful for undergraduate students to study more about growth plate fractures. We also hope that this literature review can positively contribute to academics, specifically in the medical field. That's all from me, and the next one will be explained by my friend. Thank you.
My name Pande Nyoman Dimas Prathista, three last digit of my student number 201. Now I would like to tell about definition of growth plate fracture. Growth plate fracture, also known as epiphyseal plate fracture, are injuries that occur in the area of the cartilage that separates the long bone from the bone growth plate. The growth plate is a specialized region of the bone that is responsible for bone growth in the child and adolescent. Growth plate fracture occurs more commonly in children and adolescents due to relative weakness of the growth plate compared to the surrounding bone. If a child or adolescent sustains a growth plate fracture, it can disrupt this process and potentially lead to growth problem or deformity. Can be caused by a sudden injury such as a fall or a sport-related injury or by overuse or repetitive press on the bone. The severity of growth plate fracture can be vary from a minor crack in the bone to a complete separation of the growth plate. Thank you.
Hello, my name is Putu Dinda from Sudastra with my last three-digit numbers are 130. Okay, now I want to explain about classifications of growth plate fractures. So the Seltzer-Harris systems divides growth plate fractures into 5 groups, ranging from type 1 until the 5 lower number are mild and have less change of growth abnormalities. So the first one is shelter 1 or slip. So this is type of fractures when the fracture line extends through the physis or inside the growth plate. Next, shelter 2 or above. So this is the most common type of growth plate injuries which occurs across the growth plate or physis and up through metaphysis. Next, shelter 3 or lower. So this type of fractures crosses the growth plate and descends through epiphysis. Next is shelter 4 or through. So this type of intra-articular fractures crosses the metaphysis, the growth plate, epiphysis, and metaphysis. And the last one is shelter 5 or iris. So this rarest type of growth plate fractures is caused by crush or compression of injury to the growth plate. Okay, so that's all from me. Thank you.
Hello, my name is Kadek from Agastya Karna, with my last two-digit number is 165. Now I will explain about the sign and symptoms of growth plate fracture. The most common sign of a growth plate fracture is localized joint pain after a traumatic event, such as a collision, crash injury, or fall. The patient may have swelling around the joint and focal tenderness over the physis. If the injury occurs in the upper extremities, the patient may complain of limited range of motion. If the injury involves the lower limb, the patient may not be able to bear weight on the affected side. It is important to note that symptoms can mimic ligament damage, and ligament laxity tests can show positive results. That's all from me. Thank you, and my friend will continue the presentation.
My name is Aisyah Lathifah with 3 last digit number is 076. Sign and symptoms. Growth plate fracture clinical features are persistent pain and tenderness, particularly when respond to pressure, warmth and swelling at the end of the bone, inability to move, put pressure on or bear weight on a limb, limited movement, a limb that looks different or bends awkwardly. That's all for me. Thank you.
My name is Gusti Aryawangsa with my last digit number is 144. Now I will explain about the pathophysiology of growth plate fracture. Growth plate injuries are classified into two types: primary epiphyseal injuries caused by acute trauma and secondary epiphyseal injuries caused by overuse. Tension at the apophysis results from the tendons not growing as quickly as the bone, especially during periods of rapid growth. And because the growth plate has not yet entirely transformed into bone, fractures can happen there. The imbalance causes inflammation and in certain cases cause acute avulsion. Growth plate fractures are most likely to occur in kids who participate in sports or athletic activities that involving sprinting, pivoting, throwing, kicking, and jumping. That's all about the pathophysiology of growth plate fractures. Thank you.
Hello, my name is Komang Ayu Widhiani and my last 3 digit of student number is 044. Now let's move on to the next topic, the risk factor of growth plate fractures. The risk factor for growth plate fracture vary widely. Some of the risk factors that can affect the severity of growth plate fracture in a patient over time include age. All children who are still growing are at risk of developing growth plate injuries. About 80% of growth plate injuries occur in the 10 to 16-year age range. Next is gender. Growth plate fracture are more common in boys than girls, twice as often. This is because boys grow more slowly than girls who finish growing earlier. Next is changes in bone structure. Changes in bone structure make bones brittle. For example, osteogenesis imperfecta or Paget disease. Next is excess exercise. Growth plate fracture are common in competitive sports such as soccer, basketball, or gymnastics. Recreational sports such as cycling, skiing, or skateboarding also often result in growth plate fracture due to excessive exercise during sport. Next is accident. Events such as falls or motor vehicle accident often cause growth plate fractures. High energy forces act on the surface of the body and transfer large amount of kinetic energy, causing great damage to tissues. Next is work. Studies show that some occupations such as being an athlete in football, basketball, running have a higher risk of developing growth plate fractures because excessive training loads and training volume can trigger physical fatigue in young athletes. And the last one is history of previous injuries. Research showed that having a history of previous injuries put the risk of fracture at a higher risk than patients without a history of fractures. That's all from me. Thank you.
My name is Raymond Budianto with last digit number 161. Now I'll explain about the diagnosis of growth plate fractures. Various diagnosis modalities have been used to diagnose growth plate fractures, including radiography, CT scans, ultrasound, and MRI. Radiography is often the first imaging modality used to diagnose growth plate fractures due to its widespread availability and relatively low cost. However, radiography has limitations in its ability to detect subtle or non-displaced fractures. CT scans have a higher sensitivity and specificity than radiography in diagnosing growth plate fractures. CT scan can provide high-resolution image of the growth plate and surrounding structures, but they also expose children to ionizing radiation, which can increase the risk of cancer. Ultrasound has also been used to diagnose growth plate fractures, particularly in cases where radiography is inconclusive or unavailable. Ultrasound is non-invasive and relatively low-cost imaging modality that can be performed at the bedside. The last one is MRI. MRI is a highly sensitive imaging modality that can detect subtle or non-displaced fractures, as well as provide detailed information on soft tissue injuries. MRI is particularly useful in cases where the growth plate is not fully visible on radiography or ultrasound. However, MRI can be more expensive and less readily available than other imaging modality. That's all from me. Thank you.
Hello, my name is Kevin Andrian Candra with 3 last digit number 095. I want to explain prevention method for growth plate fractures. First, warm up and stretch properly before physical activity. Stretching routine before exercising can help relax tendon and muscle and adapt to growing bones. Maintain appropriate conditioning, strength, flexibility, endurance, and cardiovascular fitness. Number 3. Not playing one sport all year round. Everyone needs at least 3 months off from their chosen sport to allow microplate damage growth to heal. Number 4. Use proper equipment. The protectors are not only used when competing, but also during daily practice. One example is using wrist guard on skateboard. Number 5. When doing physical activity, make sure the body get enough rest. When doing physical activity, the body needs time to recover. Pay attention to how intense and how long the duration of doing a sport is. And the last one is avoid risky recreational activities or sport. That's all from me. Thank you.
Next, I'm going to talk about treatment. But first, let me introduce myself. My name is Joshua with my last 3-digit number 205. So if a growth plate fracture has occurred, a treatment plan will be given by doctors depending on the severity. Generally, an acute fracture is often treated using a splint, which is typically a temporary device. This may be pre-made materials like stiff plastic or metal that have been coated in different types of cloth. They are made differently from cast, so the swelling, which almost invariably happens right away after injury, can happen without the danger of problem. On the other hand, a cast is typically a fiberglass construct that can be modeled specifically to the needs of the fracture and can be worn for several weeks as needed. The cast's main function is to maintain the bone's strict alignment as the body heals them over the course of several weeks or months. Realistically, both products can only be implemented if the fracture is aligned and still line up right. Now, in case the fractured bones are meeting in a straight line, doctor will have to move them back into place. There are two methods that can be used, invasive and non-invasive. Firstly is the close reduction or manipulation is a common non-invasive method of treating minor displaced fracture. The fracture is moved back into anatomic alignment and immobilized with a cast or splint. This procedure is often carried out under light sedation and analgesia in an emergency room or orthopedic clinic. On a rare occasion, a general anesthesia could be necessary. The fundamental orthopedic three-step method of manipulation consists of fracture distraction or pull, increasing the deformity or bend, and decreasing the deformity. This method is typically sufficient to accomplish appropriate fracture reduction, which is straighten. Now, fractures that fail close reduction often require some form of internal fixation, which is an invasive surgery method. The methods that can be used are close reduction internal fixation or CRIF or open reduction internal fixation or ORIF. The term CRIF describes the orthopedic surgical care of a fracture or fracture dislocation complex in which the fracture is closed, reduced, or manipulated and internal fixation is provided, typically in the form of K-wires. Close reduction internal fixation (CRF) is the preferred treatment for displaced supracondylar humeral fracture in children. Meanwhile, ORIF refers to orthopedic operative management of a fracture or fracture dislocation complex, where internal fixation is used and reduction necessitates a surgical, therefore open, approach. Internal fixation may be in the form of screws, intramandibular nail, plates and screws, K-wires, tension band wiring, pins, and cords, or IG tightrope. After a gold plate fracture, patient typically return to normal without any long-term consequences. If the growth plate is crushed, one exception applies: the bones will nearly always grow differently when that occurs. Doctor may be advised activities to strengthen the affected area and ensure the patient limb moves as it should after the injury has healed. If the injury is severe enough, some individual may require additional treatment, such as reconstructive surgery, for at least a year. One should schedule follow-up appointments. And that's all from me. Thank you. Thank you for listening. I'll see you later.
Okay, my name is Gusti Ngurah Dinda with the last 30 digits 112. So I'm gonna summarize our topic about the growth plate fractures. The growth plate fractures are the cartilage injuries because of the growth plate's weakness relatively compared to the surrounding bones that are classified by Salter Harris 1 to 5 that are slip, above, lower, through or transverse, and ram or fluid. And there's also the signs and the symptoms which generally will occur that are the localized joint pain, swelling, tenderness, inability to move, and the deformity. And by pathophysiology, the injury is caused by the acute trauma and are due to the apophyseal overuse. There are also some things which can affect the severity of the fractures that are the age, gender, bone structures changes, excessive exercise, work, accidents, and the previously trauma history. And the fractures can be diagnosed by doing some imaging using the radiography, CT scans, ultrasounds, and MRI. And we can also prevent the injury by doing warming up before the exercising, account the body's condition, and get the adequate rest to avoid the overuse. And how to treat the fractures is by returning the bone to its anatomical position, either invasively or non-invasively using some utensils. Okay, we've got to the last slide of this presentation, and that's all from SGD about the growth plates fractures. We're sorry if we done some mistakes. For your attention, we say thank you very much and see you.